It has been suggested that indigestion and irritable bowel syndrome represent the same pathological entity called irritable bowel. As a result, a study was conducted to determine the prevalence of each syndrome and the extent to which they overlap together, which already showed that 70% of IBS patients also suffer from indigestion, and 43% of people who have indigestion also suffer from IBS. Indigestion is a term that describes discomfort or pain in the upper abdomen. It is a group of symptoms and not a condition in itself. Where most people who suffer from indigestion feel pain and discomfort in the stomach or chest, often after a short time after eating or drinking, which makes them feel full and uncomfortable during the meal, even if a small amount of it is consumed. The difference between indigestion and irritable bowel syndrome, causes of infection. Irritable bowel syndrome is one of the causes of indigestion, in addition to a number of other diseases that include stomach ulcers, gastroesophageal reflux disease (GERD), stomach infections, chronic pancreatitis and thyroid disease. Indigestion can include a group of symptoms, which may increase either when feeling stressed, including feeling of burning in the stomach or upper abdomen, abdominal pain, bloating and a feeling of fullness, belching and flatulence, nausea and vomiting, the feeling of an acid taste, noises from the stomach. While irritable bowel syndrome is a disorder of the digestive system, is characterized by the presence of a group of signs and symptoms in adults or children, which include cramps, abdominal pain, increased gas, changing bowel habits, and food intolerance, bloating. Also, irritable bowel syndrome is a functional disorder that indicates the presence of changes in the digestive system function that lead to a group of symptoms, which means that it is a problem with bowel movement without any damage to the tissues of the digestive system. The difference between dyspepsia and IBS, associated symptoms. Indigestion is one of the symptoms of IBS, in addition to the presence of many other symptoms, including diarrhea, constipation, flatulence, abdominal pain or discomfort, feeling of colic after eating certain foods, nausea, mucus or foamy stool, unexplained weight loss, anorexia. Foods to avoid in case of IBS. Anything you eat may affect the symptoms of this condition, and although it may not be possible to completely prevent IBS symptoms, there are some foods that may trigger it. Here are some options that should be avoided or reduced by a person suffering from IBS. Dairy products, including milk and cheese. Some vegetables that increase gas, such as cauliflower, broccoli, cabbage, and legumes such as beans. Fatty or fried foods. Alcohol, caffeine, or soda. Food rich in sugar. Artificial sweeteners. Chewing gum. Nuts.